Hi guys, welcome back to another video. My name is Stefan and today we're going to be talking about testosterone gel and testosterone shots. So I have been on testosterone for 22 months. I started it on gel, was on that for 11 months. Then I switched to shots, I've been on that for 11 months. So I've been on both for the same amount of time. So I think I'm a pretty good resource to tell you the differences, similarities, and maybe what is best for you. So I started on testosterone gel because I don't like needles. And I heard about the benefits of your levels being a little bit more consistent throughout the week. And also when you start on gel, it's a little bit of a slower start and slower for you to start seeing changes. And I'll be honest, when I first started testosterone, I was actually really worried if I was gonna like the changes or not. And so having the ability to take it slow was nice. And then the reason why I switched to shots is it wasn't up to me. It wasn't because I wanted to see changes faster. It's because my insurance plan changed and was no longer gonna cover gel. And I was like, well, I wanna stay on testosterone and I don't wanna pay a lot of money or any at all. And so I switched to shots because it was gonna be free and been on shots since. And ultimately, again, even though I hate needles, I've grown to be bygones. Let bygones be bygones with needles. I'm also saying that because if you two ultimately hate needles but end up having to switch to shots, it's not the end of the world. You might find that it's ultimately not that scary and might help you get over your fear of needles. So now I want to go through the differences between gel and shots. Well, the big main difference is gel is applied topically because it is a topical gel and that is applied every day around the same time. And shots are done every 1 to 2 weeks, depending on your dose and what you and your doctor have talked about. And another huge thing is insurance plans. Now, a lot of insurances, it seems, at least to me, it seems that not a lot of them cover testosterone gel, and it is a lot more common to find a plan that covers shots. And also with price, gel tends to be a lot more expensive than shots. For example, if you go on GoodRx and try to find a coupon, testosterone gel can cost anywhere between $50 to $650 out of pocket, whereas if you're paying out of pocket for shots, it can be anywhere between $30 to $50. And another thing to consider into that is with gel, you can apply it as is. You can literally just put it in the palm of your hand and put it on your shoulder, or you can use the cap to apply it, or I used gloves to kind of help maintain the mess. But I didn't need to use gloves. And then once you're done with the bottle, you just throw it out. Whereas for shots, you need to get syringes, you need to get needles, you need to get Band-Aids and alcohol prep pads. And because you need to dispose of needles, you need to get a sharps container, which please don't throw your needles in the trash. That is a biohazard to not only you, but your community. Now, another big thing between the two is pain. Now, did I experience any pain when applying testosterone gel? No. I mean, it has an alcohol smell, but that's not really that painful, maybe to your nose. But anyway, with shots, ultimately it can hurt, but if you do it right, it doesn't. And another thing is, if you're doing intramuscular shots and it hurts a lot, you might want to talk to your doctor about switching to sub-Q shots, because that doesn't inject as deep, and you're injecting that into fat instead of muscle. And I've noticed I have done only one intramuscular shot because I was given the wrong needles. And yeah, after administering that, my muscle where I injected it to hurt for 3 days. And I will say the first month or two of doing shots, yeah, my legs were sore a couple days after. But after learning how to do it and my body getting more used to being given shots every week, it hasn't been so bad. With my experience, it rarely hurts when injecting. There's been a few times where, wow, why did that hurt so much? And weeks where I didn't feel anything at all. And another thing, if injecting feels weird and has a burning sensation, this is what I would recommend. One thing you might want to do is warm up your testosterone. And the best way to do that is you can literally just put it in between your hands and do this, or you can also put it in your waistband and for 5 minutes and let it warm up, and hopefully it won't hurt as much or at all. It doesn't. When I do this, it doesn't hurt. Now, another thing is, how consistent do you need to be with both? Well, with gel, you have to be very consistent, or at least for me, I had to be very consistent. If I miss a day, if I did it a couple hours later than I normally did, my mood would be all over the place. I didn't feel like myself. And then as soon as I did my gel at the right time, everything was back to normal. Now, some people with shots, they like somehow forget and like don't remember to do it, or like they put off doing it. I don't know how people do that, because like I have like this looming feeling over me Friday morning, like you need to do your shot. You haven't done your shot yet. That's like your first priority today, is doing your shot. So I haven't missed a single week of doing my shot. I just know doing it around the same time each week is important, because I have also noticed my mood being all over the place if I do it at random different times. But it's so nice now being on shots, just having to do it on Friday morning and not having to make sure I wake up consistently at the same time to do my shot, like if it was a daily thing. But like sometimes when I was on gel, I was like, I really don't want to get out of bed, but I need to shower and I need to put in my testosterone and then I can start my day. If you want to like have something like make you feel more productive in the morning and like you need a reason to get up, boom, testosterone gel. There you go. I will say definitely my energy levels were a lot more consistent throughout the week of being on gel. It's kind of like, I can kind of see like a difference in my levels throughout the week with testosterone shots, but like it doesn't make that big of a difference to my week, really. So folks, we have talked a lot about the differences between the two, and the main differences being that one is a gel and one is an injection. But ultimately, what are the similarities? Well, they both accomplish the same job. It's not like gel gives you one set of attributes and injections does the other. It's just gel takes a little bit longer for you to see those changes, and it's true, on injections, those things happen faster. I will say when I switched from gel to injections, my dose increased, and so my body was having to get used to a lot more testosterone, just as when I first started testosterone. So it was almost like starting it again, because my body had to readjust to different hormonal levels. And so that was an adjustment period. So another thing is I inject 100 milligrams every week. And so there'd be, so like on my syringe, it's like 0.5. There would be some weeks I would do 0.5, other weeks I would do 0.45. And there was also like, at some point my doctor was like, we should put you on a half dose. And so there was one week I gave myself 0.25. And so there was like a good like 2-month period where almost every week I was giving myself a different dose. Obviously, don't do that. Your body is being given an influx of different hormone levels every week, and your body's like, what are we supposed to do? So unless you want some crazy mood swings and some crazy hot flashes, don't do that. But ultimately, when it comes to injections and gel, your body is going to absorb it differently. The way your body absorbs gel is going to be different than how it absorbs injections, because again, they're two different things, and the way that it affects me is going to be different than how it affects you. So ultimately, what like is like the right one for you can be decided between lab works and talking to your doctor and what your goals are. But ultimately, there's no wrong way to take testosterone. If you want to be on gel, be on gel. And if you want to be on injections, be on injections. And also, are these the only two ways to take testosterone? No, they're just the two most common and the two that I have experience with. But ultimately, do I prefer one over the other or think one is better than the other? No, it's very situational and whatever works for you. And both worked well for me. I'm glad I started on gel. It was a great starting point and great for me to get used to seeing the changes. But I'm glad I got to switch to injections and found out that actually works better for me in my current lifestyle. So, but ultimately, I want to again state that there's no right or wrong way to take testosterone. And if you haven't started testosterone and aren't even sure if you want to take it, you don't have to take it. It's ultimately whatever you want to do. But that's gonna be the end of this video. If you have any questions, please leave them down below and I will get back to you. But I hope you have a great rest of your day, and I'll see you guys in the next one. Bye!